Can you give your dog Benadryl for their allergies? Well, the short answer is yes. Most of the time, I like to use a dose of about 1 milligram per pound of body weight for a dog. So, for a 25-pound dog, that means you'd be giving about one full 25 milligram caplet of Benadryl. The longer answer, though, is that even though Benadryl works well for human allergies, it's probably not going to work very well long term for your dog's allergies. Stick around to find out why. What's up? My name's Dr. Peter Mositis. I'm a small animal veterinarian, and I've been practicing for about 10 years. It's my goal to help as many animals as possible in the world by helping owners learn how to take better care of their pets. To answer why Benadryl isn't a great choice for an itchy dog, we should talk about how it works. So Benadryl, or diphenhydramine generically, is an antihistamine. In humans, one of the main triggers for our allergy symptoms are histamine. In dogs, though, a lot of that itching and scratching and biting is going to come from other chemicals inside the body, such as interleukin 31. So why did I say it would work okay at the start of the video? Well, if you've taken Benadryl yourself, you've probably experienced one of the most common side effects of Benadryl, and that's its drowsiness. So when we're using it in dogs, a lot of times what we're seeing isn't an anti-itch effect, it's an anti-scratch effect caused by that drowsiness. If you have a dog that is very itchy and is scratching at a sore spot, you can use Benadryl in a pinch to try to help keep them calm and try to stop them from doing more damage before they get a chance to see their veterinarian. All right, so Benadryl's not the answer, but you still got an itchy dog. What should you do? Well, first you should look for other underlying causes of the itch. It doesn't make any sense to start a treatment if you haven't taken away the cause, just like it doesn't make any sense to start putting burn cream on your hand before you've even taken it off the stove, right? So the most common things that we're looking for in dogs are going to be external parasites, such as fleas and the mites that cause mange, and looking for infection. If you're not sure what's going on, which is often the case, talk to your veterinarian. They can help you sort it out and make sure that you're not throwing good money after bad on treatments that aren't going to work because you haven't treated the source of the itch. With that out of the way, we can talk about the itch treatments that are going to have a good long-term effect. There are essentially three major anti-itch treatments right now that dominate the veterinary medical landscape. The first one is going to be Cytopoint. Now, Cytopoint is an injection that contains an antibody to the itch signal in dogs, right? So interleukin 31 we talked about before, that's typically what causes itch in dogs, and Cytopoint is going to bind that and neutralize it. So if it's a signal, it's basically blocking that signal from getting to the receptors inside the dog to cause that itch. What I really like about Cytopoint is that it's a one-time injection. Typically, it lasts about 6 to 8 weeks, and the reason for that is because that's how long an antibody life cycle typically lasts inside the dog body, right? So if they make their own antibodies, they're going to last about 6 to 8 weeks. It's going to get recycled. The body's going to recycle into new proteins and continue on. In this case, it's an artificial antibody, right? So they're not able to make more themselves. So what happens is they just degrade, they get recycled, they go away. What's really cool about this type of treatment is that there are basically no side effects associated with it outside of the actual injection itself, right? It's not processed through the liver, it's not gotten rid of through the kidneys, and so you can have a dog that has other things that are going on, and it's still safe to use this medication. The downside with this medication is basically the cost, right? So if you've got a big dog, this does get to be pretty pricey, but if you're able to get it on board, typically it kicks in within about 12 to 24 hours, has a really good effect. Now, I said typically for Cytopoint, that is worth noting that it doesn't necessarily work for every single dog. No medication does, and so that's one of the other downsides is that this could be a big expense that may not always work, but usually you get the idea on the first try. It's either going to work or it's not going to work, and you can start to explore other options. One of those other options is going to be a medication called Apoquel. And so Apoquel works a little bit differently than Cytopoint. It is a tablet that you give initially twice daily because you want to build it up inside the dog's system for about 2 weeks, and then you can drop it down to once a day. Apoquel doesn't block the itch signal, but what it does is it changes the way the immune system reacts to an itch-causing event, right? So it modulates the immune system, changes how it reacts, makes it have less of a significant impact. Just like Cytopoint, this one's typically fast-acting as well. The other cool thing about it is it's got an anti-inflammatory effect that Cytopoint doesn't necessarily have. So if you've got a lot of itch and inflammation at the same time, this can really help to treat both of those at once. Downsides, just like Cytopoint, it can get to be expensive. It is more labor-intensive than Cytopoint because you're giving a medication twice a day and then every day onwards from there. That variable dosing can also sometimes get to be a little bit confusing. So as far as that's concerned, just use your own best judgment. You know yourself, you know how likely you are to be able to give medications and use that to decide if this is going to be the right one for you. One of the other things that is a little concerning about Apoquel is that because of the way it affects the body's immune system, Generally speaking, we don't want to use it in dogs that have cancer because there is a concern that it could potentially change the body's defense against that cancer, the inbuilt defenses that we have. Okay, so the last medication is probably the oldest one that's been around for a very long time, and that's going to be steroids. Steroids are given either injectably or orally. What's really awesome about them is that they work really, really well for itch and for inflammation, and they tend to be on the low cost side of things. So if you have a dog that really needs help and you're in a bind financially, steroids are going to be a good short-term answer. They're not good long-term though, and sometimes they're not good short-term because they have a ton of side effects associated with them. Biggest thing that I mention to clients when they take steroids home is going to be watching out for increased thirst, increased urination, and increased hunger as well. In the longer term, I try not to use steroids because they have all those other side effects that are associated with them, right? They are processed through the liver. They are gotten rid of through the kidneys. They cause water retention, so it can be a little tougher on the heart in a dog that might have insufficient heart function. Other side effects include muscle atrophy as well as potentially resistance to insulin. All right, so those are the 3 treatments that I would typically recommend. Hopefully you know a little bit more about them now. If you've given your pet Benadryl in the past, please don't feel bad. It is what most people do. It is the well-known go-to. We tend to take what we know about humans and apply it to dogs. And honestly, it's generally pretty safe for most dogs. But like I said, it's not the best long-term treatment for it. And so these are some that are going to work a little bit better. And of course, if you live in the Vero Beach area and have a dog who's got a lot of itch, give us a call here at Mermaid Vet Hospital. Well, not here, but at Mermaid Vet Hospital, 772-925-1625, and we can get you in and see your pet today.